our esteemed viewers. Today is an interesting upload, and we are going to be focusing on the sports people, specifically the golf players. We know you face a lot of things down the pitch, and we are here today to help you. As always, Nerves and Bones Rehabilitation Center Ntinda, we are here to look at your health because our goal is to keep you healthy. On set, I am joined by Dr. 𝐂𝐨𝐧𝐭, and we are going to be talking about golf players with the different, problems, challenges that you meet while on the pitch. And today we are going to be speaking about the musculoskeletal issues that these people face. Yes, you're welcome.
Thank you.
Like I've said at the introduction, I want us to go deep down when it comes to musculoskeletal issues among golf players.
Yes, musculoskeletal problems are prevalent among golf players. Golf has become a trendy sport, and more people are getting interested in playing golf.
It's fashion.
Yes, and as much as this sport is not like the high contact sports like soccer, rugby, basketball, volleyball, these people also get musculoskeletal problems. And actually statistics even reveal that 37% of people who play golf suffer shoulder pain.
Why is it the shoulders?
Well, the shoulder is the main, it's one of the main joints that are involved. But these problems are not only limited to the shoulder. These people also get problems in the elbow, in the wrists, and sometimes even in the chest and also the hips. Yes.
The fact that this is a game, is there any way, as I am on the pitch playing, how I can prevent myself or avoid this kind of accidents to my shoulders and any other part like you mentioned?
Yes, it is preventable. But first of all, I would just like to point out why these problems keep coming. Most of the times when these golfers are playing, they do not allow their bodies to move with the swing force, because we all know that when you're playing golf, you're mostly swinging and hitting the ball. So you find most of the times they only limit the swing force to the upper body, mainly the arms, and even the chest doesn't move. So because of that, over time, they start to cause restrictions. These restrictions start to cause inflammations and pains in these joints. And then of course also the constant holding, especially the hand that leads. We call it the leading hand, the hand that holds the club to hit. Yes, because it's constantly holding. Most of the times they also get inflammation in these tendons.
You talked about the swing and then the club and then the way how we handle it. Do I really need to take in charge of how I do the club to avoid this kind of accidents?
Exactly. That is now where the prevention part comes in. It's very important that golf players, people think that it's all about just going and hitting, but training is an important aspect. How you move your body or how you involve your body during the swing matters a lot. Most of the times we keep getting these clients here, and I usually advise them that when you're swinging, allow your body to move with the swing. Allow the distribution of force from one side of your body to the other. Once you allow your body to move with the swing, that is going to prevent the condition. But when you try to keep your body fixed and you're only using one part of your body, especially the hands, to do the swinging, now that is when you get this type of injuries. So training is a very important aspect. Knowing how to allow your body to move with the swing prevents this problem.
Dr. 𝐂𝐨𝐧𝐭, usually when people get such issues, they run to sprays and then painkillers. Do we really have to look for a doctor? Do I have to come to hospital after this kind of situation?
Yes, it's very important that you get a doctor who is qualified in the field to assess your problem and then also get for you a more permanent solution. Because most of the times we all know that painkillers don't solve problems. When the chemical wears off in your system, the pain is back. So it is very important that you get a doctor that is qualified in the field to help solve your problem.
And now a golfer watching us would ask, why would I run to Nerves and Bones in such a situation?
Nerves and Bones, we have a specialized rehabilitation team. When the patient comes, we usually carry out an assessment. And it is from this assessment that we get and identify the needs of the patient, and then we develop treatment methods that are evidence-based.
Okay. So your take home about musculoskeletal issues?
What I would encourage players is that as long as you're participating in any kind of outdoor sport, always make sure that your posture, or you take time to train your posture and to train how to move your body when playing a sport to prevent injuries.
Okay. Thank you so much, Dr. 𝐂𝐿. Well, we believe that there is a lot that you need to know because it is all about your health, and that is why Nerves and Bones Rehabilitation Center, we are the spot you should run to if you want any answers. Thank you so much for watching. I am Jocelyn. Have a lovely day.